Acute kidney injury, how fast can you respond? In the ICU, seconds are everything. A delay in diagnosis can mean the difference between life and death. But when kidney function starts to fail, would you even know in time? AKI, or acute kidney injury, is a rapid loss of kidney function. It can develop within hours or in just a few days. And its most common trigger, sepsis, the same condition that already makes managing ICU patients so difficult. And AKI is not rare. It affects 1 in 5 hospitalized patients and 1 in 3 in the ICU. Among those who require dialysis, mortality can reach 80%. But here's a critical point. AKI can be reversible. Early recognition, early action. That's what saves lives. So what do we rely on today? Serum creatinine and urine output. But serum creatinine doesn't rise until more than half of kidney function is already lost. That's the blind spot. A silent phase where damage is happening, but hidden. And creatinine, it's unstable, affected by age, muscle mass, hydration, and even diet. It needs a baseline to be interpreted correctly. Urine output, just as unreliable. It fluctuates with fluid sedative, medications, and requires invasive continuous monitoring. We are working with delayed, inconsistent, and non-specific tools, when what we need is a real-time insight. In the ICU, we face so many problems. Is the patient developing AKI? Will they recover on their own, or will they need dialysis? When should we start, and when is it safe to stop? We need answers, but current tools keep us in the dark. That's why we developed AFIAS sphingotest penKid, a test that doesn't wait, a test that sees what others miss. penKid stands for proencapheline A119-159, a stable, reliable biomarker released by the kidneys. It mirrors real-time kidney function and responds immediately when glomerular filtration rate, in short GFR, begins to fall. No waiting, no guesswork. Just answers when you need the most. penKid is powerful, backed by more than 150 clinical studies. Let's look at what it offers. First, real-time kidney assessment. penKid rises and falls in step with GFR. It's a direct reflection of kidney function, unlike creatinine, which lags behind. Second, early AKI prediction. penKid can predict AKI up to 48 hours earlier than creatinine-based tools. That gives you a critical window to act before full injury sets in. Third, real-time monitoring. penKid tracks kidney recovery or decline hour by hour. It helps you monitor treatment effectiveness and patient progress in real time. Fourth, stable even in critical illness and sepsis. penKid is unaffected by systematic inflammation, fluid shifts, or comorbidities like diabetes. Even in septic shock, it remains stable and reliable. Fifth, prognostic power. Higher penKid levels correlates with worse outcomes. Increased 28-day mortality, longer ICU stays, and risk of multi-organ failure. Sixth, support for RRT decision-making. Low penKid levels suggest kidney recovery. This helps guide when to stop dialysis, avoiding unnecessary treatment. Picture this, a patient arrives in the emergency room or admitted to ICU. Within minutes, a single penKid measurement helps assess both immediate risk and long-term prognosis, right from the start. In the subclinical phase, when creatinine is still normal, penKid detects the early signs of decline. As AKI progresses, penKid continues to guide care. It's a dynamic response, allows real-time tracking of how well the patient is responding to treatment. And when the patient stabilizes, penKid helps answer the big question: can we safely stop RRT? Otherwise, penKid also can be used in pre- and post-operative settings, empowering early intervention and faster recovery. penKid is also useful for monitoring patients after kidney transplantation. No waiting, no delay. Just actionable insights every step of the way. This is precision medicine reimagined. AFIAS sphingotest penKid is built for the realities of critical care. Just 150 microliters of whole blood or plasma. Results in 15 minutes, fully automated on the AFIAS platform, and working range of 70 to 2,500 picomoles per liter. An adult reference value of 89 picomoles per liter. When the kidney function drops, penKid goes up. And when the kidney recovers, penKid drops again. Simple to interpret, fast to act on. penKid isn't just a new test, it's a new way of thinking. In critical care, every second counts. And kidney injury doesn't wait, so why should we? AFIAS sphingotest penKid. Act early, act smart. Lead your care into the future.